My son GP was diagnosed with systemic JIA and MAS when he was 3. He's now 5. We've been on this journey for approximately 20 months. He's actually doing really well right now. In the beginning, his onset was approximately 15 days in the PICU in 2 different hospitals locally. We then had him transferred by air ambulance to CHOP. He was diagnosed following a bone marrow biopsy to rule out malignancy. Right away, he was started on high-dose steroids and biologics. I guess what makes his story kind of unique is that he didn't initially present with the pink salmon rash. GP has never had a rash. His fevers were spiking 104, 105, multiple times a day. Morning, afternoon, evening, night. It wasn't just the spiking in the evening, but no rash ever. Not at onset and still not today. Also at onset, his ferritin and his LDH were both under 1,000, and he was very clinically ill. Pericardial effusion, double pleural effusion, very sick cardiac tamponade, but his inflammatory markers never really matched what was going on in his body. His typical symptoms were swollen lymph nodes, vomiting, complaints of headache, sore throat, a slight cough. He had a flare actually last year, and the first thing that he said was, "My throat is hurting," with a slight dry cough. He develops red fingertips, and his hands become red and splotchy. That's another presentation that is maybe a little unique. Not all kids have the red fingertips, so we've had concerns regarding the ILD. He had a CT scan and ILD was ruled out. He also has had pulmonary lung function tests and walks every 6 months, and his results are phenomenal. He is doing amazing. Initially, I guess I'll talk about
just 1 minute more, Samantha. 1 minute more, okay?
Okay. I'll talk about the drugs. He's been through Alaris. It seemed to control him for quite some time, maybe 7 months. Then it just stopped working. We moved to Kineret for a couple weeks with no change. We've moved to Actemra. He did that, and it never controlled him. He always had breakthrough symptoms. We added tacrolimus in addition to his Actemra, and we just never could get to really a therapeutic level. And by the time we were getting to a therapeutic level, he developed a stutter. Being a speech pathologist, that was very frustrating. So his rheumatologist, Dr. Burnham, actually thought, maybe given his clinical presentation, that he would do well on a JAK inhibitor. We started the ruxolitinib back in August. Yes, August. So he's been on it for approximately 3 months. He's had no breakthrough symptoms. He was able to wean off his oral steroid. No fevers, no rash, no indication of any red fingertips. And he's been doing great clinically. And also his labs have looked perfect for the past 3 months. It's still early on, but we're very hopeful about this medication and how well he's doing on it.
I'm going to go through a quick timeline, and especially dealing with drugs, because you can see how each of them kind of fell off and how our SJIA converted into kind of a GI related issue. So for Olivia, she was diagnosed in November 2014 when she was 10-month old. Onset was not unfamiliar for a SJIA kid. She also had MAS, but she had rash, fever, fluid around her lungs and her heart. But she never had joint involvement, and to this day still does not have joint involvement, which I'll mention she is now 6. In February 20, so she checked out a hospital with anakinra, oral steroids, cyclosporin, and actually off anakinra into Actemra infusions. By February 2015, she had an anaphylactic reaction to Actemra, so that was knocked off. Started back on anakinra. In September 2016, we're added tacrolimus. And then in September of 2016 as well was the first time we started seeing some GI involvement, but it was diagnosed as C. diff for the first time and was treated with vancomycin. In October of 2016, she got off anakinra because the dosage had to get increased to the point where she was taking 2 a day and switched over to Alaris. In 2017, she was hospitalized for C. diff again and started vancomycin. By September 2018, this is where the GI starts kicking in. We start seeing blood and mucus and stool, as well as a calprotectin level of 3,000. She had a SIG scope done and actually didn't see any signs of IBD at the time. So we believe that the blood and mucus was related to chronic C. diff. December 2018, once again, blood and stool. In January 2019, it was time for a colonoscopy to rule out IBD after weeks of bleeding. They also did a genetic panel to check for any IBD markers. She did have some markers come back for that, the NOD2 and HLA markers, as well as the colonoscopy showed signs of colitis during the scope. They also checked for C. diff yet again, and she was positive. So at this point, we learned that she's colonized. So that was probably something that was going to be reoccurring for her. In February 2018, we started methotrexate to see if that would help her IBD related stuff. And in March of 2019, we found her calprotectin was in the thousands. And that's when we started, we were suggested to start Remicade, which our concern was obviously having multiple biologics, Alaris and Remicade. So they had us stop Alaris in order to place Remicade in its place. But our concern was what it's going to continue to treat her SJIA and MAS. And I kind of skipped some flare-ups there just because I wanted to focus on the changes that have happened. But we learned at that time that I guess Remicade previously was used in some SJIA kids. So they were hoping that that would help both scenarios. And it also, so we went ahead and started that in March 2019.
1 minute
And it
more.
also, yeah, and it also helped her with her psoriasis. She was starting to get really bad peeling hands and feet and her scalp. May 2019, her calprotectin was high again. And at that point, you could not get the Remicade level any higher safely. So by June of 2020, she started Entyvio infusions for her GI related issues, which were basically Crohn's disease. And in October of 2020, just a few months ago, we've moved the Remicade infusions now to every 8 weeks, and as well as the Entyvio. We've talked about stopping tacrolimus, but we're going to wait until spring or summer. But with that said, that's kind of the end of the timeline. She has tolerated Remicade and Entyvio. We believe that Remicade is actually helping in the case of keeping SJIA MAS at bay. We haven't seen anything like that. And it's almost like the SJIA and Crohn's kind of started replacing each other. She still has never had joint involvement. And really right now we're dealing a lot more with the GI stuff. But like I said, the Remicade and Entyvio fortunately is currently working and has been working for almost a year.
My son, Ezra, initially presented at 12 months. Within a few hours of his 12-month vaccinations, with rash and high spiking fevers. We do not live near a pediatric rheumatologist, so it actually took us a couple of months to get a diagnosis. And during that time, that rash persisted and the cycles of fever got closer and closer until there were daily spikes. He did not have macrophage activation syndrome on onset, but did later develop full-blown MAS about a year into diagnosis, and had quite a long period of time where there was a discussion of subclinical or smoldering MAS possibly being an issue due to some clinical symptoms. He was initially treated by his pediatric rheumatologist at Duke Pediatric Rheumatology with NSAIDs and anakinra. Responded fairly well, but that didn't last very long for him. Like Nicole mentioned earlier, we always feel like we're mad scientists adjusting those medications constantly to kind of keep his body ahead of flares. He is now 9, so he's been diagnosed a little over 8 years, so it's really hard to condense that story down into a couple of minutes, but his most significant issue over the last 8.5 years has been really persistent arthritis, especially his large joints. His knees will get massive, and so we've had multiple joint injections to try and help correct that. We've also learned for him, especially as treatment has progressed, that his clinical or his typical inflammatory labs for SJIA do not indicate how he actually is feeling and doing clinically. So he can have perfect labs and show up to clinic with these massive joints that need the joint injections. However, last year he had a flare where we started tracking the IL-18 and S100 proteins and did see some bumps in those. So I think going forward, we have some labs that we can start tracking for him. Current flare symptoms are all the SJIA typical flare symptoms of rash, fever. He didn't have a fever for many years, but in the last year, those flares have started to include fever again. But he has some unique symptoms during flares that I have found as I've talked to more patients in the community that are not really that unique, but maybe aren't being seen in a high number of patients in individual clinics. So he'll present with these really red, burning hot ears, a really severe headache, burning rash on his palms of his hands. He complains of chest pain, and we've had full cardiac workup, so there's nothing structural, electrical, or inflammatory going on, but it's a really consistent complaint. In the most recent flares, he complains of just his skin. He says everything hurts. His skin hurts, everything. And he gets, and this is a very odd symptom, but he gets a little squishy area on his forehead that shows up like clockwork. It makes no sense clinically, but we know when that happens, it's a pretty severe flare is starting to occur. He's also had bouts of significant GI involvement. Looking back, we can see periods of time throughout multiple flares, but about 2 years ago, that reappeared while he was fairly stable, and that required an increase in prednisone to control that because the diarrhea was so excessive, he couldn't even attend school, and it was also really severe stomach pain. So for treatment for him, we've used anakinra 3 different times at multiple doses. He was on Actimra. That only lasted 3 infusions due to the severity of his disease, and he continued to decline, developed MAS, and then unfortunately had an anaphylactic reaction during his 3rd infusion. We also tried canakinumab for 8 months, increasing dose and frequency. That did not last very long. And then we tried rilonacept, which actually was a great drug for him and lasted the longest. But we always felt like we were trying to stay one step ahead to keep him on that medication, and we're never able to taper off prednisone. He's been on methotrexate this entire time, NSAIDs, which are fairly typical for an SJIA patient. But I mention that because even during stable periods, we were unable to taper those without significant increase in pain and
1
having to
minute.
restart. Okay, thanks. He has been on tacrolimus, which we discontinued last year due to concerning labs and wanting to start tofacitinib. He was on hydroxychloroquine for about 2 years and discontinued that. I mentioned earlier joint injections as needed. Prednisone has been oral since 2013, so about 7 years on that, as well as IV pulses as needed. Unfortunately, during his last flare, he also developed high blood pressure, so we're using those very sparingly. Currently, his labs are fairly stable, other than some possible anemia. He recently had joint injections and increased anakinra to 3 syringes a day. Our long-term goals and short-term goals are to try and taper him off prednisone, which I don't know how realistic that really is at this point. Possibly change from tofacitinib to another JAK inhibitor. It would be naive to say that drug is not helping at all, but it's not been this huge change that we were really hoping. And we possibly considered switching back to rilonacept with just some medicine adjustments to try and really help him. So that's his story kind of in a nutshell.
Well, I will try to cover as much as I can. Thanks for letting me speak about my daughter. Sophia is 5 years old. She is a systemic only kid who has interstitial lung disease and PAP. Her journey with SJIA started pretty typically around 10 months old with the rash and the fever. She had an MAS event, was diagnosed around 14 months, and we started her on naproxen, prednisolone, and Alaris. 4 months following her diagnosis, she had some breakthrough symptoms, and in hindsight, that's when her lung disease started, with a dry, hacky cough and pneumonia-like x-rays, so we added some inhalers. 6 months past diagnosis is when she had the ILD diagnosis officially. And 7 months past diagnosis is when she had her big sick, is what we call it. Essentially, she went into complete lung failure. She had high heart rate, high respiratory rate, low oxygen. We ultimately ended up intubating her, and she was on ECMO for 2 weeks. Following ECMO, she had a severe MAS event with her ferritin spiking at 280,000. She went into multi-system organ failure, and we opted to start the 8-week course of etoposide, and that really seemed to be what she needed to stop that event. As a result of her big sick, she now has a tracheostomy. She is ventilator and oxygen dependent. She has a G-tube for her feeds and her many, many meds, and she has kidney damage. Since her big sick, we have done a lung biopsy and confirmed a PAP diagnosis. She has extensive thickening and ground glass through all portions of her lungs. And typically she has fairly frequent hospital stays, generally in the PICU, due to infections, really because she needs more respiratory support than we can give her at home. In the last 12 months, she's had 2 CTs that show that her lung disease is continuing to progress. Most recently in her lower left lobes and the lining of her lungs. Oddly enough, and I think you'll probably hear this from other patients too, her labs look pretty normal. She does have ups and downs. We've started to monitor her CXCL9, her IL-18, her S100s. Her respiratory rate is continuing to increase. She's working harder and harder to breathe when she's not vented. She does have clubbing on her fingers. To me, they seem fairly significant clubbing. What I guess maybe seems a little unusual about her fingers is that the clubbing didn't show up until at least a year after her big sick, so it took a little while. This year, she's been relatively healthy. She's had one infection. I'm assuming it was a lung infection where she coughed blood for probably 6 months. But otherwise healthy. She's had no hospital admits. We are adding, hopefully next week, IVIG to her meds to see if we can get the inflammation under control. And if that doesn't work, we re-image her in a few months and change a JAK inhibitor and see if we can get a hold of it that way. As far as her meds, she is on 3 for SJIA, Kineret, cyclosporin, prednisolone. For her lungs, she's on 7. 2 antibiotics, Xeljanz, IV steroids, hypertonic saline, albuterol, Flovent, and she does twice a day neb treatments and CPT treatments to try to get the junk out of her lungs. She is on 4 blood pressure medications and still in the 90th percentile. She's not well controlled, and she's maxed out on dosing. For those, she's on hydrochlorothiazide, which helps with her lungs as well, losartan, labetalol, and amlodipine. And then she has a group of kind of 10 others where she has an antiviral, some belly coaters, iron, because she's anemic, sleep aids, creams for her stomas. Generally, she's a happy kid. She's a very active kid. if you didn't see all the hardware and hoses that she's toting around with her, you wouldn't know what's going on in her body. So she's had really a pretty rough initial go with this disease, and it's caused a fair amount of damage. And we are now trying to get her lungs under control while the SJI symptoms and labs seem to be pretty well controlled for her.